Okay, good morning, everyone. Okay, let's try that again. Good morning. Happy Friday. Woo! Okay. Friday's here too, as well as the first session. So this is the Innovations in Health Information Technology session, sponsored by Catholic Health Services. Catholic Health Services is the largest post-acute care provider in South Florida. I would like to introduce Jim McKean. He'll be the moderator for this session. Jim is a healthcare business development manager for AAJ Technologies. It's a full-service system integrator that helps healthcare payer and provider organizations to capitalize on the largest technologies as streamline operations, reduce costs, improve customer and patient care, and ultimately to boost competitive advantage. Jim has over 25 years experience in the technology industry, beginning in South Florida with NYNEX Business Systems in 1990, and where he was the general manager for one of the top performing offices in the nation. As a highly regarded professional in the healthcare community, his customers are consistently praising his impeccable service, the strategic vision, and the willingness to stay involved through outreach project delivery. With a solid background in HIT, Jim regularly helps organizations face the unprecedented disruptions associated with healthcare information technologies, big data, portals, population health, and integration. Jim has a BA degree in computer science from Western Connecticut State University, and he's extremely active in the healthcare community at large, serving as an active member at SFHHA, HIMSS, the South Florida Hospital and Healthcare Association, and HFMA. He's currently in the HIT committee for the South Florida Hospital and Healthcare Association and the past president of the South Florida chapter for HIMSS. So, Jim, your show.
I appreciate you all coming on Friday. Good morning. And thank you very much for that introduction, warm introduction. And also thank you for helping sponsor this event. How's everybody doing so far with the event? I thought the speakers yesterday were really good. I enjoyed I enjoyed both of them, but the population health, I tell you what, if we can get out there in the field to get people healthy and keep them out of the ER, boy, that might save us a few dollars. But today's panel, we're going to be discussing innovation in healthcare IT. And we're going to be sharing some thought-provoking ideas with you, and we want participation. And I think we have an incredible panel. I'll introduce in a second. But I first want to starting off with just 4 little points I pulled off the web this week. And one was, thought leaders agree that today's best technologies strike a balance between reducing the overall cost in medical care, increasing safety and survival rates. 2, a pillar of health reform is improving access to the best health care for more people. 3, technology is a cost-effective and increasing potent means to connect clinics to the vast medical, underserved rural regions of the United States with the big city medical centers and their specialists. 4, telemedicine is well-established as a tool for triage and assessment in emergencies, but now medical robots go one step further. They can now patrol hospital hallways on more routine rounds, checking on patients in different rooms, and managing their individual charts and vital signs without direct human intervention. Just wanted to get the innovation juices flowing a little bit. What I'd like to do is take this minute and introduce our panelists. And to my right is Dr. Jacques Orsi, Miami Children's Health Systems. Can everybody hear me? Yes. Good. He received his undergraduate degree from Arizona State University and his medical degree from Nova Southwestern University. He completed a residency in general pediatrics at Miami Children's Hospital and practiced office-based pediatrics for several years before returning to Miami Children's Hospital as an emergency department attending physician. In 2010, he became the medical lead for the hospital's digital transformation. In 2013, he was named the Chief Medical Information Officer and Medical Director of Telemedicine at Miami Children's Health Systems. Dr. Orsi is a board-certified in pediatrics and in clinical information. Let's welcome Dr. Orsi. And to His right is Edward Dibeler, Chief Information Officer. With 25 years IT experience, Ed founded the consulting firm Puma Telecommunication. Puma had developed the integrated hybrid voice software that merged the working process gap between communication and data systems. Contracted by Automated Healthcare Solutions to enhance their voice and data workflow, Ed built a 4-year alliance with AHCS. The relationship transitioned in 2012 when Ed was commissioned to serve as CIO. In his capacity, he was the chief architect behind the ezVerify product offering, as well as supporting enhancing and robust enterprise platform serving thousands of physicians nationwide. And we welcome you to stop by the exhibit hall and stop by and let them show you what they're doing on their platform. It's very, very, very interesting. And, oh, I'm sorry, I skipped over Joseph. My fault. Ed, can you just wave a little bit? This is Ed. But more than likely, Joseph will be at the booth too, so. Sorry about that, Joseph. Best plans, right? So I'd like to introduce Joseph. He's right there. Berto is a data platform leader in Microsoft U.S. Health and Life Science business. Joe covers U.S. health providers, plans, and life sciences company. He lives in North Texas and has helped enable data-driven health organizations drawing on 25 years of enterprise IT and consulting experience. His areas of expertise are focused on helping customers design business and technical data strategy, key, enterprise integration, and in DevOps. He is also a voting member on the International HL7 Committee and serves on local and national healthcare boards. Let's welcome Joe Berto. And I know I got this one right because we only have one left. So Andrew, welcome. Andrew Broderick is Director of Public Health Institute Center for Innovation, and where he leads research and evaluation projects that advance the roles of information and communication technologies into healthcare practice and policies for underserved and vulnerable populations. His research interests focus specifically on the adoption and appropriate use of patient-centered digital technologies such as cell phones and remote monitoring devices. And he just came back doing a survey here in South Florida. He's going to be sharing some of that information. That'd be really interesting. So our first speaker today, and also our major sponsor, is from ezVerify, and it's Ed Dibeler. I'd like to bring him up to the podium. Let's give him a warm welcome.
Thank you, Jim. This has been a great event for us, and it's going to be my pleasure to talk about some innovations that the crew and I at ezVerify have been developing, some with the help of AHA. It's been a great partner for us. Thank you very much, Jim, for assisting us and always being there for our crazy requests. So, as Jim mentioned, I am the CIO for ezVerify. I started out as a consultant. A lot of us in the IT field have consulted at one point or another and landed at customers who really saw the value in what we believed in. And Automated Healthcare Solutions was one of those companies for me. And our founder, Jerry Glass, Dr. Jerry Glass, is a very passionate thinker in the healthcare space and had a life-threatening experience where he got to see a lot of the problems in healthcare technology. And along with my help, we started devising a platform that was going to assist providers in giving better information to their patients, education being one of them. We have a lot of people now on the healthcare roles that have never had healthcare before, so understanding that was a problem. And as far as helping providers understand what co-pays, co-insurances, deductibles are at time of treatment, that was another big driver for us. So we dreamt up this program called ezVerify, and while I never really agreed with the naming the company that, it was a good vision, and it's expanded today to 4 different other platforms and projects that we have done, partnering with some major groups like Don Joy Orthopedics, Memorial Healthcare. So we've seen a lot of partners out there kind of joining the vision with us, and I want to kind of go through those. And I'm using this clicker here, and I don't see it working, so I'm not sure what I need to be doing.
Can we get the audio,
Yeah,
audio guy up front?
You're going to have to help me out.
Got to get the IT guy.
Is there an IT guy in the house? He handed it to me, so it was ready to go. Oh, yeah, I guess that would help. Okay.
Well, he didn't put down. Talk to that guy.
Okay, can I get your number after? Yeah, we've got a little bit of dead time here. I'll talk about, so kind of the focus, a common theme and something that we're starting to see in the House and Senate. I don't know if everybody caught the general session, the first one yesterday with two senators. I thought that was really great. I really enjoyed seeing both sides' perspective, you know, one on cost control and the other on got to have care, doesn't matter what it costs. So it's real interesting to see that that's kind of what we're battling in Washington. But it's nice to see the states starting to get involved in transparency. I'm a big believer in transparency, but I think our company takes it a little bit further than that. There's not just transparency for the patient. There's transparency for providers, transparency for payers. These state payer databases, I'm not sure that that's really the right answer. I don't really care what other people pay for knee surgeries and hip surgeries across the state. Doesn't really help me. I think it's kind of dangerous because now we have all these reimbursement rates in one giant database for the state to look at and squeeze more money out of the hospital systems. That's just my opinion. I think it goes further. I think the consumer is the driving factor. A gentleman mentioned the other day that, well, emergency room visits, you're really not going to make a decision based on money when you're having a heart attack. Well, that's true. You're probably not even going to go to a website when you're having a heart attack. Or you're unconscious in a car accident. But a lot of emergency room visits that we see, you're waiting in the waiting room for a few hours, unfortunately, and not being seen. So when you do have a cut and you're able to educate yourself on what the nearest hospital is that is in your insurance plan, right? They all have different contract rates. So one hospital may cost me $50 versus a $250 entry fee. So those are the types of decisions that I think consumers are going to make. Right? My children are on app crazy, and they always ask me, why can't it do this? Why can't it do that? And that's the kind of innovation that I think we're going to start seeing in healthcare. And this kind of links to big data. What consumers are making their decisions on is important for providers. They're our clients. Those are our customers. If they're going to make a decision because for a few extra $100 on a procedure, they can go somewhere has a better rated facility or a better rated physician or a better experience. Maybe it's a little bit further away. They're going to make that decision where to spend those dollars. I think that is coming. Healthcare is something that we're all paying dearly for. I know that I have a family of 6, so my healthcare costs are kind of up there. And we do make good decisions. I'm lucky enough to beta some of these apps when I had a child sick on vacation, and I was pulled up my app and learned that there was a hospital that I could go into an ER for $50 versus paying the $150 urgent care fee. I made a quick decision and saved myself $100. For me, I'm fortunate enough that that's not a huge impact, but for someone who has an ACA plan with a $6,000 deductible, that could be a life-changing amount of money. So these are the types of transparencies that we're talking about for the consumer side. We're letting them take control of their healthcare experience. First product I want to kind of talk about, actually the first thing I want to talk about is how our minds work over at ezVerify. We're a healthcare company first. We started out in the physician world writing software to purchase healthcare claims, so we had to really understand what reimbursements were. We had to really understand what contracts were. We had to understand payer level rules, state rules. A bill has to go in an 8 by 11 envelope, or it has to be trifold with special watermarks. I mean, all these crazy nuances of billing we had to understand. So we come from that world. We come from the world of regulation and compliance. Fortunately, we hire lots of lobbyists, and we're in legislative a lot, and we have to adapt. So we're not an out-of-the-box company. We feel that software should adapt to our needs, not us adapt to its needs. So that's kind of our mindset. A lot of our technologies that we develop are what we call decoupled and non-dependent. So When we write a piece of technology, we make sure that it can be applied to any other piece of technology that we write for a customer. Kind of accelerates that process. One of the benefits for us, when a client has a need, maybe something comes down from the house and they need to change the way we do billing, we're very easily changing that in as little as 3 weeks. One iteration, clients say, hey, listen, I need my software to do this. So we make that change and they're seeing it in their next release. We're able to do that because we're not writing a piece of code that just solves one problem. We're writing many pieces of code that can be adapted into any workflow or any issue. It's kind of what makes us a little bit different, and it gives us the ability to partner so easily with a lot of clients. The first product I want to talk about, or actually, I keep saying that. I might as well just jump to that product, but I'm going to go ahead and talk about some of the technologies I'm talking about, the core technologies. Verification tools, interfacing with gateways, clearinghouses, payers, and getting as much data as we can from them to make the best decision. We all know that the standard is not really the standard. Every payer, every gateway, every provider sends data differently. There's going to be little nuances, and that's what makes healthcare integration so difficult for a lot of us. Writing intelligent rule sets and engines and having adaptive technologies lets us figure out when Blue Cross makes that change and puts the copay segment in a different type of service type on a 271 return. Crazy little things in data is what makes automation very difficult on the billing front end, back end side. So rules engines, like being able to understand that when I have a payer at this type of facility with this contract, with this insurance plan, I have to do X. That type of automation is helping that $12 an hour an employee not make a $100,000 an hour mistake when they're checking in or entering that data, which is the crucial point for us in the back office process. If we get bad data in, we're getting bad data out, and we're chasing a $100 claim for 90 days and losing our shirts. So these are the types of things that we're writing rules against. Mapping. So it's funny, we're in 38 states. We have 2,000 physicians nationwide using some of these products today. And when I go to these clinics, they all have their own different workflow. Adoption is the biggest problem that we have. Getting people to buy in. We demo the product, they use it for 30 days, and then you see it drop off. They don't want to change their workflow. I don't want to change what I've been doing. I've been doing it for 10 years. I'm the greatest at what I do. These are the things we hear. So we have to adapt to that. We have to make sure that our software can do what they want it to do. Otherwise, they're not going to use it, and we're not going to be successful. And the core mission, which is getting that clean data in and out and having a great patient experience, it's never going to happen if they don't use the product. So mapping is very important. What we call mapping, okay, you want us to call BCBS Blue Shield or whatever kind of crazy name, or you want us to have a different type of click-through workflow because that's what you're used to? Let's give you that. That's why these are some of the adaptive things that we're doing. Bridging technologies, interfacing, HIPAA 3.0. Can't wait for that one. So interoperability is the big name of the game, right? Interoperability is going to be the big topic for the next few years. This is going to, Epic's seeing some problems with interoperability. They had a little bit of a skirmish with the feds because of it. It's going to keep coming. We need interoperability. Being able to adapt to what we have now, the things that we have available, the APIs, the web services, doing the best with what is available to us. That's what we have to do now to try to speed up and expose why is it important that I have a web service that can return all the data that I need for this particular project. Well, this is why, because now you're making me jump through hoops, and look, at the end of the game, the hospitals picked up providers. There's a better patient satisfaction rate. Their success rate on first pass on claims is increasing. We're going to see this. We just have to keep pushing forward for this innovation. Data mining is a big topic, especially in the IT world. We have people chasing us down all the time for data analytics because we do a lot of transactional volume. Data mining is understanding where I can get this data and then turn it into usable data. EDI messages, flat files, HL7, all of this type of data comes at us, but oftentimes it's represented in a screenshot on a website that someone has to sit there and interpret. So being able to mine this information raw and store it in data sets that can be used for analytics down the road or in automation processes, very important. This is what's going to drive innovation going forward. This is what's going to drive all of these apps. We're seeing it today. We're seeing EMR systems starting to develop these little self-serve platforms. Well, they're starting to understand that we have apps and needs too that they're just not in the space to write. So we need that. I'm going to go jump on to some of the product lines because I think I'm running a little bit long. So, okay, good. So ezVerify Professional, this was the flagship product. This is just verification. This was the driving force behind what we did. We had a lot of clients that use 3 to 4 different types of verification tools because they just don't trust the data that they get. So what we do is we go out and we retrieve this data from the sources of truth. We mine all of this together. We aggregate the data and say, you don't need to go to 6 or 7 different sources. We'll do it for you. And not only will we do it for you, but we'll represent it equally the same no matter where the payer is, no matter where the data is coming from. You know, a lot of people using Availity, they're using Passport, they're using MDON, they're using all these different sources because they have different contracts. Well, we have the mapping technology. Why not? We just make the decision. You want some data from BCBS or from United Healthcare? Well, we know the payers to get that data from. This is where our rules and our mapping comes from. We locate this data and we present it to the patient, to the user in a very usable format. Very easy to read, very simple. You can make those decisions real time. Of course, it's not sexy and it doesn't allow me to show that interface in the back end, but this is just a general representation of what something looks like. Let's give you some tools. If you're in urgent care and you only need to know what the urgent care data is, let's jump to that immediately when you launch the page because that's the type of user you are. So being able to customize these things per the user, per location, that's really cool. That allows that end user to do their job more efficiently, and then you get that buy-in. You know what? This tool is easier for me to use. It's not something that I have to change my life to use. This is something that changes for me. So the ezVerify platform, which was kind of the nucleus of why we started writing all this software, is verification. That's how it all started, right? Using 5 or 6 different tools. Nobody trusted what it was. So let's figure out what we have to do with what's available today and make a platform. We have a client, Palm Beach Orthopedics, was one of our first adopters of our technology. They don't use the desktop tool, really. We wrote a mapping engine in the background that pulls all of this data, aggregates it, and we make a custom message, exactly the data they want to see. We drop it right in their EMR 48 hours before the appointment is scheduled. So it's just a batch job. Nothing I can show you here because it's in the background. But they were able to increase their bottom line cash intake by understanding what the patients owed by $3 million annually. So they went from a $400,000 annual front desk collection to $3 million. That's a staggering number. They were able to reduce their back office workflow and staff because we automated that process. They don't need to chase claims anymore. They don't need to chase patients for their co-pays or anything. They knew right up front, and the patients were reminded of it when they came in, and they gladly paid. The biggest problem that they had was 90 days later when they sent them that bill, they had an issue with the patient. Why are you sending me this bill for the remaining co-pay now? I'm not going to pay that. They lose a patient, they have a bad experience, and the patient never returns. So here, if you educate the patient up front at their time of need, they'll pay anything to get that treatment. And it's transparency. You're showing them exactly what's due them. It's very important for them to understand that. And once they pay their copay, they're happy. They're happy to pay their copay. 90 days later, they're not getting that balanced bill, and they're not having a bad experience at the doctor. Everybody wins. So that's kind of the driving force behind that. And then once we started getting into the healthcare data arena, we realized there's a lot of information out there that we can do more with. Some of it was creating more than just active, inactive. Look at the data, make some decisions for the user so that they can be alerted to some things. We did an installation up in a New Jersey facility that was having huge problems with a state contract where they were being told people had insurance when they actually didn't. It was the local Medicaid program. And they were getting all these active insurance results from, I think it was Availity, and they were getting all these rejections from the payer. Well, they did have insurance, but they had dental coverage. They did not have health care coverage. So this is the type of information that's kind of important. So that active result, yeah, sure, they did have some sort of insurance, but what kind of insurance did they have? What kind of coverages do they have? So the unspecified coverage, not everything is an active coverage. Multiple payers, right? Secondary, tertiary, this is important information. We support all that. We show all of that information. And we can even jump to those payers and retrieve those plans as well in an automated process. It's really important. It helps a lot on the back end, maybe not so much on the front end, but that's a huge lifesaver. The ACA grace period, something that we're seeing now becoming a real problem, being able to identify when a patient is in default and their plan is going to lapse because they haven't made their payment and their subsidy hasn't been paid, right? So that plan's about to expire. You've had patient in bed for a few weeks, and if that plan expires, it goes back to the initial date of the non-payment, not as of the date of cancellation. So huge liability. This is something we call the heartbeat technology. You have a patient in bed. We're hitting that every 24 hours to find out the status of that plan. If you have someone in bed and they go into the ACA grace period where they're about to lapse, that's something you want to know when you're sitting and looking at a $30,000, $40,000, $50,000 charge. So then, of course, your inactive failed responses. That's self-explanatory. Also, I've added some calculator features. This is an really attractive display, but I didn't have a lot of real estate to show you. So being able to integrate with contracts that the payer or the provider has and make exact calculations on what the responsibility is, how am I supposed to bill going forward. So we're completing that front-end transaction at point of care, showing the patient exactly what they're owed, why they owe it, and collecting the payment. So this is a complete workflow for the provider, completely automated. This kind of speaks the same thing. This is a product we built for DonJoy Orthopedics. DonJoy, global DME provider, had a big problem. They were all paper-based and have never collected a patient's copay before. Yes, that's staggering. Global company had a huge problem. They came to us. We wrote this app, had to be on iOS, so of course we obliged. And we wrote an application that was a very simple thing for the dispenser to use. All they simply do is use the camera on the iPad, pass the driver's license in front of it. All of the data on that barcode on the back was digested into the system. They hit go, and they're instantly getting the patient's verification results. This is the second biggest problem that they had. Patients always argued with them that they had coverage when they don't. We all know DME is not covered under the regular office visit. So this is the point where they're able to simply hand that iPad to that patient and say, these are your coverages. This is why you owe me $50 or 10% of this brace or this boot. And then go right into the calculate. I think I did something wrong. Sorry. And then go right into the part where we actually select a product or service. And in real time, it uses all of those pieces of data, the co-pays, co-insurances, what's remaining on their out-of-pocket balance. It does the calculation for them right in front of the patient. Not only that, the patient signs off that they've received this product or service. They're done. Everything's completed in this transaction. So not only are they first time collecting co-pays from patients, but they're lessening those calls that they have to make 90 days later when you owe me $400 for this boot. This is why you owe the money. They don't have to do that anymore. So they've reduced. They actually closed an office in Minnesota because they don't need that call center anymore. They're not chasing their patients anymore for co-pays. They literally changed their revenue cycle. They literally changed how they're chasing money and how much they're not chasing anymore. And they have better patient experience. And the physicians love it because instead of dispensing DME that's going to piss their patient off down the road because a third party's chasing them, that goes away. So now the patient's treated, the doctor's happy, the DGO's happy, everybody's happy. It's that transparency again that we're exposing. This is everything that's going to be involved in this healthcare experience, this healthcare transaction. This is what's important for the patients. Transparency really isn't about money per se. It's about understanding what's real. ezVerify 123, something really cool. Michigan Hospital Association came to us and said, we want to reach out to all 8 million residents of our state and provide them some information from the MHA. What can we do? Well, how about an electronic health insurance card, right? You go to a doctor or you go to an urgent care, what's your copay? I don't know, you're a doctor, don't you know that? So here you are, you have an application that runs on your mobile device. It'll find local hospitals for you in or out of network according to your health insurance plan. And it shows in real time what your current balances are at the time that you run the app, what your copays, your deductibles are. And if you flip that, there's a little link on that card, if you flip it over, it provides a QR code for instantly dumping all of the information needed right into the EMR, EHR practice management system, keyless. So who cares what's on your driver's license? My name's Edward on my driver's license, but you know what my United Healthcare plan has me down as? Ed. So when they bill me as Edward, what do you think happens to that bill? It comes back. So all of this data, the address, the date of birth, all that information that's critical, it doesn't matter what's on your driver's license. It matters what's at the payer. You can fix that later. But by actually automating this process and dumping the data that's directly from the plan, which is exactly what you need to bill, that's saving a lot of missed keys and chasing money. This is a really fun app. It released June 1st, so we're starting to see some data now. But this is a great analytics tool for the facilities as well, because now they're going to see what patients, de-identified of course, what patients in what area with what plans are going to what facilities. Why not mine? This is a starting point. For the next time they log in, maybe we ask them a profile question. What kind of products or services are you going to look for in the next 3, 6, 9 months? That type of data that we're getting from the patients, because this type of transparency for the patient is also helping our providers in the state of Michigan, because they're understanding how can they do better for their patients, right? Everything's electronic. They don't want to sit there and talk to someone on the phone with a survey, but you know what? They'll sit on a bus ride or in a taxi ride or in an airport and use an app and answer a few questions to get some really cool data. Healthcare is not exciting. It's not Flappy Bird or any kind of crazy app that you can run on your phone, but you know what? It's going to get there, because healthcare is a big part of my budget, and I want to do the best with my healthcare dollars. And if I can stop hitting that button, I'll probably have a better show. This is the web-based version of it. So everything that's on the application on the mobile device is the same on the web. We write responsive technologies. The iOS app was really the first one we ever did that was really an app. But this is the website. When it notices you're on a mobile device, it changes the format. So we don't have any software to install on a phone. When we come up with an update, it's instantaneous. We don't have any education to do. We believe in no one trained you to use Facebook. You should be able to use this app. That's kind of our mentality when we do our development. Something really exciting, this is the last piece. The portal, transparency portal. So this is kind of a culmination. This is a product that I'm excited about because I'm the owner of it. And this is everything that we've ever written all in one app. This is an experience, Amazon-like, that's going to allow patients to go online, create an account, see what their plan covers, select a facility, find out what their, select a procedure, a process. Maybe it's an MRI, an X-ray, maybe it's a knee replacement, hip replacement. They're shopping, right? This is real transparency. This isn't state payer database transparency. This is, what are my contract rates with any of these providers, and what is my responsibility? Because if I go from one facility to the next, even though they may be in the same group, they have a different contract. That's going to be a different cost. So what are these real costs? And then once I've decided that this is the procedure I need, and I'm going to have it here, what's the rating system? How's the hospital rated? How's the physician rated? How has the experience of patients who have gone before me and had this procedure done, how has that experience happened? And this is where they're going to get this information. This is full circle transparency. Right now, this is for the patient. Patients can be able to make their copay and real time find out what the availability is for scheduling that procedure. They're going to make that schedule, and then they're done. This eliminates a lot of the back end work for the facility, but it's a marketing opportunity. It's saying, hey, you know what? We're a little bit pricier than the next guy, but look at our ratings and our reviews. Or maybe we're not, but you know what? We're close to you. and we are a pretty decent facility. This is where you're able to market to your local patient demographic. This isn't a national system. This isn't for everyone in the country to use. This is installed regionally at hospital systems. So you're looking at a target audience, right? This scales very easily because we're not talking about tens of millions of users yet. So part of the features, it's that Amazon-like experience. Again, no one taught you how to use Facebook, so you should be able to use this app. So you can see that I've searched for a procedure, and it's just a list showing me live the ratings, a little bit of a description. It's showing me the managed care and the self-pay rates. So it's showing us, you can search by keyword, body type, specialty, so we're making it very easy for the user to search. You know, when you're searching in Google and you type in the word knee and it has a bunch of explanations, anything with that word in it, we're going to return that result. We're making it very easy to use. We're also supporting bundling and unbundling. Let's say that you want to break apart your experience. I want to have my blood work, my MRI done at one facility because it's really close to work, but I want my procedure done at this facility because the ratings are good and the copay is decent. In real time, you'll be able to select and put together your experience and build out exactly what your procedure is going to look like financially and location-wise. Once you're done, you can we can use those. The feds have a word for it. It's the financial assistance models, right? This is really important. We have to provide that information to them. So here they can pay now or they can defer payment, save the experience, go back to it later. So I know this seems like this is really impossible to do. This is really complex. Well, it is complex. It's something we've worked on for a few years now, and it's just coming to fruition. But we're not opening this up to heart surgeries. We understand that there are certain procedures that require case management. This is going to be kind of the dimmer switch approach. Some products that are a little bit more complex that we're not really good at yet, we're going to flag that'll go to a work list, and a caseworker will get back to them with a proper quote or estimate for the procedure. But this is for the real easy, simple to use ones, and then we're going to get better, and we're going to get better at it. We understand that there's going to be the unknowns. For this particular program, our partner with MHS, they've agreed to, this is the price, this is what it's going to be. They understand they're going to be high on some and low on others, but we're going to find a mean, and we're going to create a real final experience for the patient. They're going to go in, they're going to get their procedure, and they're going to walk out. And they're going to walk out happy because they're not going to chase bills anymore, right? Scheduling is going to be live, so we're going to be using a lot of the interfaces. This is built around the Epic platform. We're also building for Cerner, and we're looking for a third. Right now we're searching for a facility with a dev environment that will partner with us. But the way that we've built all our technologies is exactly how this one's built, decoupled, no dependencies, so we will be able to attach this to any EMR, EHR, practice management system. We have zero limitations. So what's exciting is we're able to develop interface teams in parallel. So when we go to market with the next release, we'll be able to support not just one practice management system, but several, and probably get 80% of the market share out there as far as attach points. So the system's very scalable. There's going to be an admin here. We have content management systems, again, with that non-dependency methodology. Anything that we don't have or anything that the clients want to interface with, we don't make it dependent. We've built those systems, the content management systems, the contract management systems. Yes, you may have it, and we will interface with it, but if you don't, we will provide a very light version, so that way we're not worried about the next client and their situation. We have all of the answers already built into the tool. So that's all I have. I'm not sure if we're doing questions now or in the panel later, but if anyone here has got questions about the technologies or has an idea and is looking to work with a team, I'd be happy to talk with anyone here. We look for partnerships. So everything that we do, we understand that we need you. We need the ideas. Obviously, we can't think of everything because we're not in the healthcare space providing care to patients. But we want to look for partners. And if anyone's looking for something and has a great, crazy idea, we love crazy ideas. Thank you very much.
That's innovative. When you save a company, what was it, $400 million to $3 million?
Yep,
Innovation pays, so you got to take it to the next level, right? And doing IT since 82, 83, I think I've seen quite a bit. That's really good. So being thought leaders, let's bring down the cost of healthcare and get it out to the patients or consumers. So my lovely assistant here, Sherry Mills, is also on the HIT committee chair, and she is trying to pull up the Microsoft presentation. There it goes. And Microsoft, I have the clicker here. Microsoft is going. I didn't know you have to ask.
Okay, that's
There you go. Thanks.
Thanks, Jim. Good morning. Is everyone doing great? So, guess who my favorite doctor is? So, it's Dr. Leonard Bones McCoy. He boldly goes where no one had ever wanted to go, and with his little tricorder, he meets patients and delivers miracles in a matter of minutes. And growing up in the 60s and 70s, I was an avid Trekkie, watched it all the time, and really when I was thinking about innovation in healthcare, it's amazing that we're creating some of these miracles today amongst ourselves. And that's really what we're driving for is how can we deliver better patient experiences and better outcomes for people. And some of you may have seen this story, this video. These are a collection of stories. I work in Microsoft. I've been with the company for 14 years. Work with roughly 10,000 of our health plans and providers and life sciences companies. And this is really, we ran this for the Super Bowl last year. But these are real people in here and real case studies and stories of things that we've been able to do in health.
We're going to bring up Dr. Jack Orsis from Miami Children Health Systems. He's a CMIO, and he's going to share some of his. Thanks. I'm sorry. So I'll come back in and get that running.
Yeah, so I've got 3 videos that are, we'll go out of turn and kind of keep this interesting. But the videos that I brought were really to streamline and kind of show you some interesting things that I wasn't able to bring. But hopefully it'll inspire, and it's a pretty important part of the presentation. So we'll get back to it here in a few minutes.
So to begin with, Ed, I want one of those insurance cards, those digital ones.
Me too.
Because I got a family of 6, I never know where my cards are. And Joe, I'm a little disappointed. I wanted to be your favorite doctor, but that's okay. Bones qualifies. So thanks for the opportunity. I'm here to tell you a little bit about what we're doing at Miami Children's Hospital, but more so about the whole concept of telemedicine. And if you remember nothing about what I say about telemedicine, just remember this, ingrain this in your brains. Yes, it's technology, but really telemedicine is about access. Just think about it, it's about access. It's about bringing the hospital to the patient, bringing the provider to the patient instead of bringing the patient to the hospital. So just remember that, it's access. A lot of people think that telemedicine is this glorified FaceTime or it's a Skype on steroids, but telemedicine is far more than that. We have Bluetooth stethoscopes so that I can hear a patient's chest if they're in China and I'm in Alaska as clear as if I was there in person. I can see into patients' ears with teleotoscopes, and the definition that we see with these high-grade instruments is unbelievable. I would rather see patients with these instruments than what we have in the office now. In fact, whenever I practice in the emergency department, I go back and I use the regular otoscopes, and I'm let down what you can compare this to is kind of like when you had your analog TV and the first time you saw a high-definition TV. That's what it's like using these instruments. We have high-definition dermatoscopes, teleotoscopes to see the eye. We have high-definition cameras. I mean, this is really incredible quality, high-definition images that we generate out of telemedicine. We have real-time EKGs, so you can have the best cardiologist at Harvard checking on real-time arrhythmias on a patient anywhere in the world, and he can suggest treatment in real time. We have real-time electroencephalograms. Again, same scenario, this time it's about seizures. Anything that can be transmitted, over the web, we can practice telemedicine with. I lost the signal here. Can you hit spacebar for me?
At the computer.
I'm not in control. PowerPoint stopped when that taskbar came up on the bottom. Oh. All right, but this still isn't working though. There we go. We have real-time ultrasound as well. Oh, no problem. Thanks. Real-time ultrasound as well, and we have cloud packs. And it's not just us, but anyone getting into this field has to have this. So we can look at images done anywhere, either before the consult, during a consult, or after a consult. You can see that this is not FaceTime. This is not Skype. This is actual practice of medicine. And this is an example of one of the carts. So you can see that we have the two high-definition monitors. Above that, we have a camera that captures the video. On one monitor, we'll have the teleconferencing going on, which is secure and encrypted, of course. On the other monitor, you'll have the digital data. In this shot, you can see we have an EKG machine, vital signs, pulse oximetry. You can see a stethoscope hanging next to the keyboard. Really, really cool stuff. This is a portable cart that we developed after the earthquake in Haiti. We realized that we had to be able to travel easily. This fits in the overhead bin. Essentially, everything that we have on the large cart, you have it here. The difference is you don't have the same screen real estate. You don't have the same screen definition, but you're able to transmit and receive and use the high-definition instruments. This is our command center. So just to play off Joe's analogy, you really walk in here and you want to say, "Beam me up, Scotty," when you come in here. It's really very cool. We have 7 pods. They have snap glass for HIPAA purposes. They have noise canceling, the white noise going on, so you really don't hear any of the consults going on. And, you normally think of telemedicine being mobile, right? It has to be anywhere you are. Why would we build this central location? The doctors really like coming down here because, as you can see here, they're catered to. When they go inside one of these pods, they have 3 large high-definition monitors. One is for the images or the medical data being transmitted. The other central one is for the teleconferencing, and the one to the right is for the EMR documentation. That's Dr. Alvarez, one of our radiologists, reading a 3D reconstruction of a brain. They also get IT support. As we've seen today, there's always AV issues. That's one of the things with telemedicine. When they're there, they don't have issues. The patients prep beforehand. They make sure the audio video is working. If anything were to happen, they have an AV person right there to help them. So they really like that too. And we have telehealth navigators that will set up the appointments and coordinate all the specialists that have to come in for the visit. So that's kind of the reason. We get the fact that telemedicine is mobile, but we also have this central location for our consults as well. This is our conference center. We have regular meetings with international groups and patients. I gave a talk here to the pediatricians in Peru about telemedicine. It was great because they were able to really buy into the concept that you can have high definition and real-time conversations, flawlessly, and so they really enjoyed it. Our urologists meet monthly here with a bunch of urologists across the nation to discuss pediatric urology problems. So this is a very convenient place to get together. This is our global wall. originally designed after also the Haiti earthquake. It's touchscreen. As all our centers are highlighted there, you can drill down into the center and see the center from that touchscreen wall. But originally, we were going to think about using this also for outbreaks and epidemics. Fortunately, we haven't had any. We prepped it for Ebola when we had that scare, and thankfully nothing materialized on that. But we're ready to start mapping and using analytics with the outbreaks with this. Again, we're big fans of mobility. We have our own app shop. This is something called MCH Anywhere. We have a patient-facing version, and we have a physician-facing version. And there's pretty soon there's going to be 1 million of these out there. Everyone's going to get into this space. So that's kind of, in a nutshell, what we use from a technology perspective. All our doctors have these on their phones, on their iPads, on their desktops, and we're really, as Ed is, we're trying to be device agnostic, operating system agnostic. We want you to be able to get to this from anywhere, no pun intended. But let's talk about some cool stuff with telemedicine. So I think Andrew's going to be talking about population health or referring to it. This is a Wi-Fi scale. Doesn't seem like a big deal. I can track my weight on my phone. Don't look at it like that. Look at it this is a congestive heart failure patient, right? This is a patient who we know that if he suddenly gains 10 pounds in 1 week, he's not taking his medications or he's failing. Maybe his insurance isn't covering his payments. If we had this and these results are being transmitted to our centers, I can zoom in real-time telemedicine, what's going on, find out the situation. It's going to be so much cheaper for me to go home and to his house, send someone there, and give him his medicine for free than it is to have him admitted to the hospital for 2 weeks. I mean, this is how we have to think. We've got to think out of the box, and telemedicine is really going to help us do it. And if you think bidirectionally, if he has a question, he shouldn't have to wait until his appointment in 3 weeks. He can talk to somebody immediately, a nurse in triage, who can then, either answer his question or punt him to the next guy who can give him the answer. This is how we have to think about keeping people healthy and out of the hospital. This is a wireless electroencephalogram. It's for any of you who have had it or have seen someone have it, you are completely wired to a device that captures all your data. It's extremely uncomfortable. You're not happy when you have one of those on. Even going to the bathroom is a chore. This is still in prototype phases, but this is where we're going, and you're going to have EEGs done in the comfort of your home rather than having to come to a hospital and sit, maybe a day or two, sit in a hospital. So very, very cutting-edge, disruptive technology. This is a patch called a Metria patch. It's made by the same guys who make labels. I think it's Avery Dennison. And this is essentially a cheap Fitbit. This is something you can just strap onto someone's chest, and it's going to give you respiratory rate, it's going to give you heart rate, it's going to give you temperature, it's going to tell you about your sleep cycles. You don't have to invest in this. Literally, these are the same guys who make those labels that you put on file folders, if you guys still have file folders. This is, one of many products that you can put on your chest, and it'll capture arrhythmias and then push them to your cardiologist or push them to whoever you want them pushed to, and you can set up rules and alerts so that the providers or whoever's screening these this data can intervene based on heart rhythms. You're not going to be carrying around heavy halters anymore. This is going to be convenient. This is Scanadu. This is a really cool product. I don't know if anyone knows what Scanadu is. So Scanadu is this portable product. You hold it between your thumb and your forefinger. It's still in the venture capital stage, but there's prototypes out there being used. Hold it between your thumb and your forefinger. You hold it against your forehead, and it's meant to be used by a layperson. It gives you your heart rate, gives you your temperature, gives you your blood pressure, your pulse oximeter, so the oxygen in your blood. Very cool, very convenient, easy for patients to use. They have a different version of it that will also analyze a drop of your urine and to give you your urine values, your protein and your glucose. And I don't know about that one. I think if I went with that version, I'd get two, one for my forehead and one for the urine, or at least I put it against my forehead first, and then I do the urine after. I don't know about that one, but very cool stuff. It's the direction we're going. This is James Bond kind of stuff. This is a contact lens. Google's working on this with a few other people, and what this is going to do, it uses an algorithm based on the sugar in your tears and extrapolates what your blood glucose is. So this is very cool. Instead of sticking yourself all the time, you can actually, hopefully down the road, it'll make your eyeball glow or give you like a heads-up display like a pilot and let you know what your level is when it exceeds a certain threshold. But this is going to be in our lifetimes. This isn't something, 100 years from now. This is going to happen. This is also in development. This is coming out of China. This is a little patch that not only acquires physiologic data but has medication embedded into it. So based on your body's values, it'll deliver medication. And I'm sure everyone here is familiar with Eric Topol. If you're not, I'd get familiar with Eric Topol. He's a really big HIT cardiology guy. He says that in our lifetime we will have some device implanted into us that will detect if you're having elevated cardiac enzymes, and will not only release a dose of aspirin, but will call 911 and let your doctor know that you're having a heart attack. 10 years ago, I thought this guy was crazy. There's no way. This is where we're going to be going. Again, body area networks. This is also something very cool we use in telemedicine. All sorts of devices that you can wear. Go ahead and incorporate that with your smartphone and Wi-Fi. Your doctor gets your data. Nurses can get your data, and it can become patient-generated information into your EMR. So this is all, again, through the use of telemedicine. Consumers are demanding it, and there's no choice. We have to go down this line. It makes sense. As an ER doctor, I can tell you 50 to 60, maybe higher % of the patients in the ER don't need to be there. Oftentimes, office visits, you don't even need to be there. Really, that's the truth of the matter, and a lot of this can be screened through telemedicine. And as we move towards value-based, pay-for-performance, telemedicine is going to pay for itself. Again, access, really, mental health is an example. There's not a lot of mental health in rural areas. This is a perfect example to increase access. Downstream revenue, you're going to identify patients that are going to need MRIs and who are going to need surgeries and caths and stuff. Follow-up care, this is huge. I mean, think about this. You just had surgery, you have to have a 3-day follow-up or a 5-day or a 7-day follow-up with the doctor. You're not too comfortable, you had surgery. It's a half hour in the drive to the clinic, it's a half hour in the clinic, it's 20 minutes in the exam room for the surgeon to come in and say, looks good, thanks, and walks out. You took a half day off, maybe someone had to drive you. Think about this. You have a pre-scheduled appointment. You could be at work, you could be at home. At work, hopefully you have an office, not a cubicle. You show him the incision, he says it looks good, and you're done. 5 minutes, in and out. I mean, that's really where we should be going. Mental health, as I mentioned earlier. Chronic disease, I think this is massive. This is really where we need to be. Small percentages of patients consume the vast majority of our healthcare dollar. We all know this. In pediatrics, it's something like 5% of patients spends 40% of the healthcare dollar. I'm sure in the adult world there's something similar. Telemedicine can really keep these people out of the ERs and out of the hospital. Can you stop all? No, you can't stop all, but I need to save money. We've got the triple aim, right? Better patient experience, telemedicine helps. Better population outcomes, telemedicine can help. And decrease per capita cost, telemedicine can help. And chronic disease is really going to be the place in the value-based care where we're going to see its use not blossom but explode. Because right now, people look at telemedicine as, well, there's a lot of overhead and there's a lot of income coming in from it. When you turn it around and you say, I'm preventing 100 ER visits a day, now suddenly it pays for itself. And people are going to be clamoring to have this. Our brand name is MCH Anywhere. We've got a great website. You want to check it out. And we'll wait for questions after the panel's done, right? All right. Thank you.
Are we going to try to get Microsoft up again on the screen? The sound? Yeah, I think he is.
What is technology? What can it do?
When I lost my eyesight, I thought that my painting days were over.
How far can we go?
By using your hands, you can actually control your X-ray.
Technology has the power to unite us.
Hang on, honey. Hang on.
There he is.
You see him?
I can see him.
It inspires us. Technology has taken us places we've only dreamed.
Now I can do whatever I want.
It gives hope to the hopeless.
So your device is on. Can you hear me talking?
And it has given voice to the voiceless.
But some of those stories that you just saw, Braylon Edwards, a little boy who can walk through the help of technology. Steve Gleason, former New Orleans Saints player who's living with ALS, is able to have a better quality of life. And Sarah Schumann, someone who's born deaf, suddenly able to hear again through technology. These are all customers that I've met all of them, and it's the most gratifying thing of what I get to do is to see real life, these modern day miracles happen. And at Microsoft, we have a bold mission statement. If you've never seen our mission statement before, it's to empower every person in every organization on the planet to achieve more. Every person in every organization on the planet to achieve more. And the way that we're realizing this today is we have a strategy called Mobile First, Cloud First. This isn't mobility of devices. This is a mobility of the human experience. And it's connected and enabled through the cloud, which is the computing fabric that's all around us. Everyone in here probably has a smartphone, is connected to the internet right now. And these are the capabilities, that when Miami Children's, they were talking about, telemedicine and kind of those Fitbit scales. This connects up to that fabric, and that's why we talk about them together. So we want to make these experiences available on every device, on a multitude of devices, not just the ones that exist today, but the ones that exist tomorrow. And we have a long-term approach to innovation. Like I said, we've been in healthcare from an industry standpoint for 18 years. We have 1,200 dedicated healthcare professionals across the world, many clinicians, doctors, nurses, and we spend nearly $12 billion annually on our innovation budget. And the way that we've been able to bring innovation into the daily lives of our employees is we do things that are kind of interesting. We have something called the Microsoft Garage that's open 24/7. It's got beer on tap. It's got a fridge. Anyone can go in there, and we have a host of technologies that they can play with, and create things. 3D printers, a holodeck, believe it or not, and lots of other really interesting things. We're approaching a time of our year where we do something called 1 Week, and it's been going on ever since Bill started the company. And people can write papers and they can present their ideas to the executive team. And so we call it our annual employee hackathon. And we get a lot of great product ideas from that, but we also do the same thing with our customers. We open up innovation channels to our customers to create things. And so we do that through these events called Future Decoded. So if you ever see anything from Microsoft that says Future Decoded in healthcare, you definitely want to come because they're great events. But the other staggering thing to notice is who in technology spends as much as we do in R&D, and we've always been at the leaderboard on the top of R&D. One of the interesting things in cloud computing, we're delivering cloud computing to underserved areas by taking servers and submerging them at the bottom of the ocean. What this does is it allows mobility of computing to places that all they have to be close is to a coastline, and we're using the power of the ocean temperature to cool the servers. So some pretty interesting things that we're doing there. We're also spanning the Pacific Ocean with a 4,500-mile cable with Facebook. So we do a lot of things that are really innovative. And the bold ambitions that we have of really how we combine these technologies and capabilities together is in the areas of reinventing productivity, building the intelligent cloud platform and create more personal computing. And in healthcare, these are ambitions that we're working to achieve. So related, creating personal computing, one of the things that we're doing with one of the technologies is creating a better way to do medical training. And we partner with Cleveland Clinic, who I know some of you might be here, and Case Western University.
We've been teaching human anatomy the same way for 100 years. Students get a cadaver, then they look at medical illustrations, and it's completely two-dimensional. and the human body isn't.
Microsoft HoloLens is a holographic computer that you wear. It enables you to bring your digital world into your real world.
At Case Western Reserve University, we are focused on solving problems and creating new knowledge.
My job is to teach, and I really think this could impact almost everything that we teach people. With HoloLens, you can see the muscles on top of the skeleton all at the same time. You can bring them in and out and exactly understand where things sit.
You can take any anatomical part and show any of it. You can move it around, you can make it kind of translucent so you can see through the outside, and that really helped me understand how cardiac anatomy worked. I actually had a moment where I found the aortic valve, and it was the first time that I'd actually seen the aortic valve in relation to all the other anatomical structures. It was a way of seeing it that you couldn't do with an actual heart.
I think this will improve students' confidence in learning anatomy dramatically.
By creating simulations with the HoloLens that lets them have an experience where they can fail, that would be the best way to learn, because we don't allow people to fail too much in real-life medicine.
With HoloLens, you could imagine having a class standing around a model, almost like a tour group in a museum, where they're all interacting completely naturally. I spend a huge amount of time to make sure they become the best professionals, because it's all of our jobs to make the world a better place.
Working with Case Western Reserve University to create this paradigm shift so that we can leap together with students into the future of education. We believe that HoloLens is going to enable us to do that.
We talked about being able to use it to teach art history. We have an anthropology department too that I think will enjoy this technology.
Anytime you change the way that you see things, it changes the way that you understand them. As soon as you can change somebody's understanding, then they can change the way they see the world.
So HoloLens is something that we've been in development for 5 years. It was really interesting because we wanted to keep it a secret at Microsoft. So guess where we put the R&D for that? We put it right underneath our cafeteria, a place where everyone comes all the time, and nobody knew it was there. Because people were coming in all the time with big boxes, and it just looked like, hey, food supplies or something for the cafeteria. It was the most obvious place, but the best kept secret for a long time. And that's not the only kind of innovative device. So the HoloLens is a fully functioning computer, much like the computer I'm wearing on my hand right now. So this is Microsoft Band. Band is really interesting because it takes my real-time heart rate, galvanic skin response. I can measure UV rays and what my exposure levels are. It tracks it. And this is very powerful because you notice we've got a whole ecosystem here. We've had Health Vault actually for the last 10 years that exists. Health Vault is free, so any providers who are looking for ways to take some of this, these device inputs and data and share them with your patients, it's a free and easy way to do that. It's kind of a gateway to many health devices. So, pretty much half of the devices that we saw in the last presentation are already existing connectors that are built into Health Vault. So the Tinita scales, CVS, for instance, Walgreens, all the major labs, all the major EMR systems have connectors to it. And so really the possibilities when you start talking about telehealth really open up, because not only can you track what's happening with patients, but you can do it in real time. I actually gave a demo once where I gave some of the audience this, and I said, okay, I'm going to shock you in a couple minutes. And I watched everyone's heart rate go up. It was pretty fun. But, another device that's great, talking about ezVerify, this is a great device. So the Surface Pro 4, one of the things that's different about it is we've built in here facial recognition for sign-on. So you notice I went over there to the Windows 10 device, and we had to kind of type in the password. So on the Surface Pro 4s, you can actually use facial recognition. It actually measures three-dimensionally your face and the blood that's flowing in your face, because you can't just, take a picture of someone and hold it up and authenticate. And this is actually something we developed with Kinect. So if you have an Xbox One and you work out in front of it, it'll actually track your pulse without wearing any devices, because it's measuring the amount of blood that's flowing in your face.
I'm Saqib Sheikh. I lost my sight when I was 7, and shortly after that I went to a school for the blind. And that's where I was introduced to talking computers, and that really opened up a whole new world of opportunities. I joined Microsoft 10 years ago as a software engineer. I love making things which improve people's lives. And one of the things I've always dreamt of since I was at university was this idea of something that could tell you at any moment what's going on around you.
I think it's a man jumping in the air doing a trick on a skateboard.
I teamed up with like-minded engineers to make an app which lets you know who and what is around you. It's based on top of the Microsoft Intelligence APIs, which makes it so much easier to make this kind of thing. The app runs on smartphones, but also on the Pivot Head smart glasses. When you're talking to a bigger group, sometimes you can talk and there's no response, and you think, is everyone listening really well, or are they half asleep? And you never know.
I see two faces, 40-year-old man with a beard looking surprised, 20-year-old woman looking happy.
The app can describe the general age and gender of the people around me and what their emotions are, which is incredible. One of the things that's most useful about the app is the ability to read out text.
Hello, good afternoon. Here's your menu.
Great, thank you. I can use the app on my phone to take a picture of the menu, and it's going to guide me on how to take that correct photo.
Move camera to the bottom right and away from the document.
And then it'll recognize the text. Read me the headings.
I see appetizers, salads, paninis, pizzas, pastas.
Years ago, this was science fiction. I never thought it would be something that you could actually do. But artificial intelligence is improving at an ever faster rate. And I'm really excited to see where we can take this. As engineers, we're always standing on the shoulders of giants, building on top of what went before. And in this case, we've taken years of research from Microsoft Research to pull this off.
I think it's a young girl throwing an orange frisbee in the park.
For me, it's about taking that far-off dream and building it one step at a time. I think this is just the beginning.
So Saqib was a hackathon winner, so that was an employee who saw some of the things that we were doing in cognitive computing, which actually all the technology that you use to do that exists today for you as our customers to leverage. And it's really interesting, and you know how this is working to build the intelligent cloud platform. Dartmouth Hitchcock has actually built a platform that they call Imagine Care. It's actually a business, and their goal is to help serve rural populations with state-of-the-art care. And one of the things that they're able to do with this cognitive platform is they're able to, you know, the little cards that you always ask the patient, how are you feeling today? And it's got the 7 versions of happy faces. So we can actually, with our cognitive computing platform, tell you exactly how people are feeling based upon that and mirror that. So you can actually get the information from lots of their different devices. Like I said, galvanic skin response gives you some clues. But actually on any of the phones platforms, so iPhone, Android, Windows phones, they have cameras, and you can actually have their picture taken, and it will analyze their picture and tell you exactly how they're feeling at any point in time. And there's an app out there if you wanted to see this. You know, it's kind of fun. It's called howold.net, and you can take a picture of yourself. It works great at a party to see, you know, hey, how old do I look? Right now, they always guess me somewhere in the age of 35, but I'm actually 50. So I like the app. It's working for me. But this is one of the lists of some of the things that they're looking at. So they're measuring blood pressure in real time, heart rate in real time, and this is kind of a case management worker view of what they're looking at. So on a remote center, much like the command center at Children's, they're able to look at their patients and find out, you know, which patients are bubbling up to the top. And this patient obviously, you know, had some trends and traits that bumped him to the top. You can see the pulse, you know, oximetry in real time, heartbeat in real time. So it's one of the things that they're using to, like I said, you know, reach underserved markets. We also have another partner that actually won of our Innovation Awards of the year. They're based out of Boise, Idaho, Prescriptive. So someone asked me earlier, you know, how's Microsoft Azure competing with Watson? And, Watson's been in development for a long time. It did a great job at winning Jeopardy. You may have talked to them, but they're still kind of incubating that whole thing. And we've been able to take, massively scale computing and bring it to healthcare, and it's ready today, and we've got customers using it and partners doing great things. But as we move more toward value-based care, what Prescriptive built is they built a rich analytics platform that works with any analytics platform, any EMR, to deliver the insights that you need. So you go into their gallery and you say, okay, what type of models am I looking for? Well, I want, care coordination model. I want readmission risk model. I want this, and you pick them out and you pay for them by the drink, and you only use them when you need them. So if you only need them for a week, use them for a week. If you need them for a month, use them for a month. But they built this entirely on our platform, and they're just growing like gangbusters. They've gone through first seed round of funding, and the people who are funding them, it's all the hot venture capital. It's from the Bay Area, and really interesting company. But some of the other problems that we're solving that are interesting with devices. So we have something called Project Premonition that our Microsoft research team is working on right now, where we take drones. And one of the things, everyone's heard about Zika virus, especially here in South Florida, and everyone's worried about it and how you monitor it. Well, we've actually taken the monitoring to a different level. Why don't we monitor the insect populations before they even touch a human? So to get the insect populations and to get those tests, the way they do it today is they take a cube of dry ice and they place it somewhere conspicuous on the ground, and they wait for the insects to come, and then they have to take them, hopefully while they're alive, and analyze their blood and find out where they've been. It's all, really interesting. But now this whole area is called computational biology, and it's an area that we're heavily invested in. So we take drones and we move those traps up in the air into trees and other places where large amounts of mosquitoes congregate. We can even do it in midair, of trapping the insects and analyzing them in flight. So we can track where the diseases are going, what that insect population looks like, how many diseased insects exist in that population, and stopping the spread of disease. So it's also very helpful in combating, where the bat populations are moving, because that's another factor in Ebola. You've probably also seen the commercials of Virginia Tech and how they're Dr. Wilson Wu down there is helping to cure cancer. So the way that we do cancer testing today in the life sciences industry is all done with scale computing. So it's large-scale processing power, and they can do so many more tests. And one of the nice innovative things that they're doing today is we've teamed up with another partner who has real-time sensors. So you can actually take real-time measurements of drug efficacy in the bloodstream of patients while they're ingesting the drugs, and see how it processes and build better treatments. And then another thing that we just came up with in computational biology is something called Project Azimuth. And we've got many people working on that. But in our lifetime, we're going to see the eradication of certain diseases that affect various aspects of the population. And it's all because we now have scale computing that's available to you as a service that you can turn on and turn off when you need it. And you can use lots of different things that are available to you. In this area of reinventing productivity and business process, it was interesting, the conversation we had on telehealth earlier, because the challenge is we still have 1 billion plus people in the world who are not sufficiently served by any doctors whatsoever. And you look at 1.3 per doctors per 1,000 people. In the Sentinel events and just the shortage of global healthcare workers, we're going to have to rely on technology to help us get there. And that's exactly what Adventist Health System had done. They had implemented Presence, which basically tells you, hey, where's my staff, and are they available? So it's self-directed. It knows if you're in meetings and if you're not. But you can also do instant messaging. And they were able to eliminate paging in a hospital completely just by using this, because you have it available on any of your devices that you carry. Whether it be a tablet, whether it be an iPad, whether it be a Surface, whether it be a phone, iPhone, Android, Windows. And it's a great way to kind of get those messages out there and help coordinate. So they've got that deployed in 10 states for Adventist Healthcare System. But another thing that's interesting, and it seems Star Trek-ish, when I saw it 3 years ago, it's called Skype Translator, and it's now in Skype for Business. And it allows you to speak in your native tongue to someone who doesn't speak your native tongue, and it does the translation. So right now it's available in 22 languages, and it's really amazing, because especially when you try doing something that you're not fluent in, like for instance me speaking Farsi. or Chinese Mandarin, and having someone on the other end talk back to you, and it gives them what they're saying, and it's pretty interesting. So that's when I first saw that. That takes telehealth to a whole new level, because as you heard here, he was having a consult with a team in Peru, and I bet he was doing it in Spanish. But what do you do if you have a doctor who doesn't speak Spanish? And with a shortage of healthcare workers, this becomes increasingly interesting. And this is a technology solution that's available today that you can do this. It's another good real-life use case. This isn't science fiction. It's science fact. Providers are actually using this today. So this is I'm actually a patient here at Dallas Neurosurgery Center, and they started using this. It was interesting how this came about when we first had the conversation about presence. They're doing real-time consults with patients, and they're getting paid for it. So they actually will spend, in terms of consult time, doctors will consult with patients. It's secure, it's HIPAA, end-to-end from the consumer side all the way through the enterprise. So you don't have to worry about anything, like one of the big challenges we see in healthcare today is doctors texting images. Well, that's kind of a HIPAA violation right there. But this is a secure way to stream video and text and rich information. And they're making $120 per visit on something that takes them about 8 to 10 minutes per visit. And they have a dedicated doctor who, with certain times that they pretty much go through all their consults, their virtual consults, and they spend a morning doing that, and they spend the afternoon in surgery or doing in-person patient consults. But the stream of revenue that it's added to them, it's like a 125% increase in revenue. So they're growing and having some good success. So that's it. If you haven't heard of Microsoft in Health, I hope you come visit us. jpart@microsoft.com or microsoft.com health, and let's continue to making those minor miracles happen every day.
Thanks, Joseph. Appreciate it. Innovation is key. You see more and more of this every event that I go to, where they actually are breaking out sessions at HIMSS National where they just have one big session on innovation. And I was at FIU last Saturday. I'm on the advisory board for HIT education. And they just put a whole section into the education for undergraduates on innovation. So they team the students together to come up with apps like this. So maybe we could do something with Microsoft with them and get them in the garage, right? So I'd like to bring Andrew up next. And Andrew Broderick, he's the Director of Public Health. Do you have it? What would we call, what is the title to it?
Digital Health Solutions for...
It's right there.
Yeah, sorry. Good morning. Digital Health Solutions for Vulnerable Populations. It has my first name, so Broderick should be the beginning of the title of the... Maybe it's not loaded, but that's okay. I can just talk. Yeah. Okay. Well, good morning. My name's Andrew Broderick. I'm not from a technology company, but I'm from a public health research organization, and just happened to be in Florida at the same time as this conference is taking place. And we've been conducting some research through focus groups, so it's very much formative research, talking to different vulnerable populations as part of a project that's funded through the Aetna Foundation around what access vulnerable populations have to digital technology, how are they using that technology, what their experience is, and in what ways are they using digital technology to support their health and well-being. So what I'd like to do is just share maybe some of the background to that, maybe why are we doing that research, and maybe talk a little bit about what we learned here in Miami. Some of it is complementary to what we heard here today in terms of what some populations shared with us. But overall, the reason we're doing this research is because there's no shortage of technology, there's no shortage of digital health solutions out there, but nobody really understands what low-income, underserved, vulnerable populations are doing when it comes to using technology and supporting their health and well-being. So our motivation was to actually go and talk to different communities, talk to different populations, and ask them and listen to them and hear what they had to say. So while we were here in Miami, we did about 7, 8 focus groups with populations that represented a PACE program of elderly patient populations. We talked to low-income populations living in supportive housing. We talked to formerly homeless populations currently in supportive and transitional housing. We talked to the visually impaired at Lighthouse for the Blind. We talked to first-time pregnant mothers and new mothers at a WIC center here in Miami. We talked to people going through addiction treatment services and recovery for substance abuse treatment at Banyan Health Services. And finally, we're going to, just after this session here, go to one FQHC and talk to different populations that are the primary focus of the prevention and treatment of chronic conditions. If you look at the literature, you'll find basically that there's a lot, not a lot known about, what populations, vulnerable populations are doing with digital technology. There's a lot that's designed for them, but in many ways it's not meaningful, it's not appropriate in terms of their use of technology when it comes to supporting their health and well-being. And many solutions are designed and really, they're built, and let's see if they come and use it. So if you go to Apple or Google and you look at all the apps out there, there's over 150,000 apps out there for health. How many are being used in general by the population? You can look at IMS Health and actually read what their analysis shows. Very little is being used. And so what we want to do is really understand what could be designed and what could be developed in a way that would be meaningful and appropriate for many populations. So when we ask them about their about their technology access, what technologies are you using? Do you have access to? Predominantly, it's a cell phone, and some people will have access to a laptop or computer for personal use. Many will have to go to another setting, like a library or in the facility where they're being housed or homed, in a way that they can access an internet cafe to go online. One interesting observation we found through the focus groups is people don't only have one phone, they have 2 phones. And for most time, they're using a government phone or they're using a very basic feature phone for texting and voice. Then they'll pull out a smartphone. And when you ask them, well, what do you do with the second phone? Well, it has no service coverage, but it has Wi-Fi enabled access to go online. So they carry the smartphone just to be their computing device. When you ask them, what do you do on that device? Well, they're doing everything from personal finance and banking. They're doing everything from benefits and enrollment for government programs. They're doing everything from job search and applications, all on this small, tiny device. And you have to think about the challenges that they face when it comes to the usability and accessibility of technology to be efficient and to be successful in many of the activities that they're doing. When we ask them about what features of the phone are you using most, or do you enjoy using most, or are most popular with you, texting is the #1 issue or feature that they're using in many different facets of their life. So they find it convenient, they find it short, they find it more meaningful than picking up the phone and talking to somebody, or even if somebody calls them, they're not always going to answer the phone if they don't recognize the number. So you have to think, I'll get to some of the healthcare issues that kind of came up later, but we were first just asking in general in your life what you were doing. Interestingly, personal finance is something a lot of people are doing on their phone. So they're very comfortable going online, moving money around, paying bills, and, having a lot of their personal information, being kind of digitally available or accessible, and in many ways kind of secure. So that is one area of their life where technology is very seamlessly integrated into. When we ask them about some apps that you're using, FaceTime, Tango, very, very, very popular. And so they really like that visual element. When you ask them about social networks, many people are going to Instagram more than they're using Facebook just for fun, but they're going to Instagram for the image-related communication that takes place there. Put that with FaceTime and Tango, that's more important to them to have that personal connection when they're talking to friends, family, other people, in terms of the communication and interaction that they're having. When we asked them about how they use technology for health and well-being, our first questions were about what kind of questions do you have? What kind of information are you looking for? So a lot of the time it came down to looking for information on drugs, side effects related to drugs, just having more information around the drugs that they're taking. Secondly, it was around health conditions. And thirdly, getting information on providers and looking at reviews of providers. When we asked them about their search strategy, how do you go about finding that information? Many people would go to Google and they would just search terms. They would go to, for example, we were in a group yesterday, they would go to Google, they look at the results, and they can see from all the different results, are they all saying the same thing, or are they all saying different things? And if there's a certain consistency in the responses, they take that as being maybe correct information. Some people go to YouTube. They search YouTube, and they look for videos that give them the answers to the questions that they have. So, very untraditional ways of asking questions. And sometimes if they don't know the way to ask the question, Google helps them frame the question and helps them understand medical terminology too. So behaviors like that is what we were trying to get at in, what are the practices that you have. As I say, drug information was very, very popular with them. And when it came to their interaction with healthcare providers, text reminders were very, very common. So we get a lot of reminders to come for appointments, and they enjoy that. They find that very meaningful and appropriate when it comes to the communication interaction through technology. Patient portals. Before we went into some of these focus groups here in Miami, and we'll also be going to New York and Louisville as two other communities as part of this research. Many organizations told us we have patient portals, but nobody's using them. We asked them why, and they don't know. Is it an issue related to awareness? Is it an issue related to just people being comfortable using technology? So when we asked them in the group about, do you know that your provider has a patient portal? Do you know what a patient portal is? Do you know what you can do? Some people said, yes, I use it. I go onto my patient portal. I can schedule appointments. I can secure message my doctor. I can have a conversation, and I can, get my kind of test results, etc. Most people don't know that capability exists. And I think, there's another important learning in there in terms of some of the training that could take place around awareness, and also what they can do in terms of going to their patient portal and the capabilities that enables them to manage their care. So I think, again, another build it and they will come issue, but many people aren't aware, and sometimes they don't really know what to do or what they can do through that mechanism. So when we ask people about some of their attitudes and opinions when it comes to healthcare, some of the number one issues were, trust in the healthcare system and the motivations that providers have. So we heard a lot about scams. We heard a lot about I don't trust. And it wasn't just related to healthcare providers, but it was, if I'm going to share my personal information online, then I'm concerned about how other people are going to access that and how they're going to use that. And I don't trust their motivations if they're telling me I should do X, Y, and Z. So there is a lot of kind of, attitudes that are potentially negative, but in many ways not always accurate. But again, the population, that's their perception about, being online and sharing a lot of personal health information. So security and safety was a big issue for them in terms of, personal health information and making that available. But in many ways, they're also seeking personalization and convenience in using technology. So some people told us, if they need to see a doctor, they'll just go straight to the ED. But many people will actually have to go to, their doctor's appointments and that. So when we asked them, well, how could technology better serve you? Would you be interested in having a FaceTime feature with a doctor or provider in a way that you could have a conversation and then decide whether you need to go to the ED or whether you need to schedule a visit, appointment, etc. And many of them, find FaceTime-like features or services would be very, very helpful to them. So again, going back to how they use it in their daily life, and then how you think about that could be translated into a kind of healthcare service setting. And that came up very good. Texting reminders were also very popular. If they had reminders for many things, for medications, for their appointments, again, highly convenient, highly personal, and appropriate for the way that they use technology. We heard a couple of issues, people who are dealing with very severe chronic conditions, about drug delivery services to the home. And, you know, some people who are taking opiates find that they don't get those drugs delivered personally to their home, and looking for services that might in some way be able to verify and authenticate who they are, and therefore have those drugs delivered, rather than them having to go, you know, out into the community, take a bus, and, you know, wait in line, and, you know, get those drugs that they need on a continuous basis. We heard a lot about a lot of apps. You know, for example, we went to a visually impaired focus group yesterday, and we heard about the lack of apps that are developed for the visually impaired. And, you know, the kind of inconvenience that they feel that those apps that are available are so overpriced that they're just ridiculously expensive to them. And we did hear an example of the app you just put up there in terms of being able to take a picture, and being told what that picture actually contains in terms of content, and being very useful. Siri, which is developed by Apple in terms of that speech interface, and behaves like a personal assistant, was very, very useful. And not only for the visually impaired, but we heard having that speech capability as the interface would be more helpful than having to type or having to use other input methods. So thinking about a personal medical assistant, or ways that they could have questions answered using speech, and then to kind of condense the information that's found and bringing that back to the individual, are some of the ways that technology could be developed more effectively for vulnerable populations. Online support groups. So many people are on social networks, but are you on actual online support groups like Patients Like Me? No, never heard of it. Would you think those kind of support groups would be meaningful to you? Many people find yes, and having the visual aspect again built into that online support would be something that they would get a lot of benefit out in terms of a lot of the issues that they're dealing with. So that's just some high-level kind of issues that kind of came up, wanted to share with you about how technology could better serve many different populations, and especially those at risk for health disparities and with low income and other resources, to be able to use technology effectively.
Thank you, Andrew.
Okay, thank you.
It's great research. Is there a website everybody can go to
well, we do have a website, but there's no information related to this project in terms of the findings yet. So Miami was our first community, and shortly in the next couple of months we will be kind of reporting out and kind of working with the different communities to actually work together to develop and co-design some solutions that we can bring back to those communities. So.
We had a population health panel yesterday, and they said, you know, just asking 3 questions, you could almost determine where that patient should be. And what I want to do is, we have about 15 more minutes to open up to questions. So I'd like to open up to the audience for our question, and our panel will answer. And anybody have questions right now? Any other questions? I know we're kind of bouncing between questions before. Yes.
Yes. Yeah, we actually on Azure have the highest level of certifications available in the world. So if you look at it, we're ISO 27001 compliant, and everything, that's the most stringent standard in the world. So we adopt that, and we're the only cloud provider that has that standard. Everything else flows from there. So we have FedRAMP, FedRAMP High, FedRAMP Medium. As you know, FedRAMP, you have to get invited in. So we have a health plan that we're working in right now, and they say, I want FedRAMP High. We're like, well, what do you have a need for FedRAMP High? And they said, well, we work with the VA, and we've got some claims. We're like, okay, the VA has to invite you in for this purpose. So we're HIPAA high-tech certified. You can actually go to Microsoft.com/Azure, and we've got a whole section on our certifications what services are, because we constantly release new services. We've released 550 in the last 18 months. So it'll tell you exactly which services are on a FedRAMP cloud, which ones aren't, which ones are HIPAA and high-tech, high-trust certified, to enable HIPAA and because that's one of the things that you have to look at. You can have bad security on your end and bad data governance, and that could impact your ability to reach HIPAA certification. So no one really provides, quote, HIPAA certification. They provide a HIPAA compliant platform. Yep. Yeah, Office 365 is there, and many of our core Azure services are already there. And the other thing with Azure is the business associate agreement. So we collaborated with research institutions, with providers of all sizes to create our business associate agreement. And one of the things you'll find in there that's kind of the some of the nasty little thing in cloud providers is IP protection. So I know a lot of our customers that we're winning right now are coming to us and saying, okay, what about IP protection and the ability to use our customer stories and images without our approval? Well, that's one of those little lines down the bottom of their business associate agreement that they put in there. So ours was developed by industry, for industry. We've had it longer than anyone, so come check us out. If a lot of those things that I was sharing and showing are available on the Azure cloud today and in Office 365. So.
Thank you, Greg. Anyone else? Question in the back, please.
I go back to the same question before. Examples of business models for telemedicine that are actually working and maintaining the patient relationship.
Was that the monetizing of the telehealth?
Yeah.
So that's a really good question, and there's not an easy answer to it. So you have to look at your organization's business model. So those pure telemedicine companies, MD Online and things like that, they have I think a lot of them really started out as venture capital things, and you see some of them are, not lasting very long. It's a tough model to sustain. People still think that insurance companies should pay for their medical care, and I don't disagree with that. I think it's something like 20 states or maybe 22 states reimburse for telemedicine. So you got at least half the country isn't doing it. So there's the whole adoption piece. And while people don't mind paying for tickets to the Heat game, they don't want to drop even $40 for a telemedicine visit sometimes. So that whole model is difficult for that solo, I only do telemedicine business. There are people that are doing successfully. So Amwell is doing successfully, and other companies are doing successfully, but they rely on economies of scale. So they have a core group of doctors, and they license them throughout the whole United States, and that's how they get their volume. That's how they're able to sustain it. If you look at a hospital, from a hospital perspective, you look at telemedicine not so much as a cost center or a service line, but more of a platform of delivery. So I look at it like, my cardiologist can now, send their services out, and my rheumatologist and my geneticist, I can really project that care. And I see telemedicine as a technology, almost as if it was, I'm not looking to see how I'm monetizing my phones or monetizing, other things that are platforms of delivery. So you have to look at it from the perspective that your business model is your primary driver. Now, having said all that, when we get into that pay-for-performance model, as I mentioned earlier, telemedicine is going to really, quote-unquote, pay for itself. And a simple, easy way to look at this is if you're a hospital, you can set up a telephone triage. Much like Andrew mentioned, you can call in and say, do I need to go to the ER or can I see the doctor tomorrow? And you start preventing 10, 20, 30 ED visits a day, and you're at risk for those dollars, which the average cost for an ED visit is $1,200. Now you're talking about every day I'm saving $20, $30, $40, $50,000 with telemedicine. Suddenly it's crazy not to have it. So I don't know if that answers your question. There's not a single answer to it. At Miami Children's, we do have some cost agreements with people, and we have We're the hub. Spoke sites do pay a lease agreement with us. We do charge per fee-for-service for some international consults, and we also do a lot of charity work. But we don't look at it as a profit center.
So one of the things you see a lot with telehealth, just to add on to that, is just expense reduction of existing processes. So when you look at your processes for things like grand rounds, a lot of our customers in health use Skype for Business to do that. They used to have time and travel and things and nurse staff meetings, especially with between shifts. You can easily connect with people that way. And the nice thing about Skype for Business is you can have Skype, the consumer version of Skype, and Skype for Business connected, and that's a protected conversation. It's all encrypted from the client all the way through the transmission. So it's HIPAA compliant from the start. So those are the models that I think are the no-brainers. Reducing time and access just for things you already do in a healthcare setting. And telehealth is definitely coming. But it's going to be one of those things that we're not going to think about. It's just going to happen. It's going to be like, okay, well, yeah, we got presence information. Not only presence information for people, but I've got Cook Children's Hospital in Fort Worth, Texas. They've actually used it for surgical equipment. So they've got presence for when we've got a kid who needs critical care and they're on a chopper coming on a life flight. What's the medical diagnosis at the point of impact that the paramedics are seeing, and how do we prep for surgery, getting the right people, the right equipment, the right supplies, the right medicines in there. So it's really, there's some far-reaching implications of kind of automating the healthcare delivery.
Yes, please. Just strike my comment from the minutes. We're in a conundrum. You bring up a great point, but at least our hospital, I don't know what's going on in Texas, but my hospital is a fee-for-service hospital. I make money on volume. If tomorrow I institute this and I drastically drop my ED visits and I drop my admissions, we're going to have to call in consultants and form focus groups and figure out why our volume dropped and how can we increase market share and how can we bring those volumes back. So we're in a conundrum because of what you pointed out, is that fee-for-service model. Until I'm at risk for dollars, this really isn't going to take off because and we should do what's right for the patient. We should do what's right for the patient. And going to the ED is not always the best answer. But right now, seriously, if we went ahead and dropped volume by 10, 20%, the bean counters in the hospital would be freaking out. And we'd be calling, emergency meetings to see what happened, who stole our patients. It's a conundrum. I think as we move forward and we get more at risk, we're going to see adoption just happen naturally.
Yeah, I'd like to add something to that. I see it similarly, but I believe we're going to see an infrastructure change. I think the profit models of today, we see through software and advancement, it's not really all about making a revenue center, or it's more about reducing costs. We're seeing reimbursements go down. Believe me, when these state payer databases really get put to use and analysis is put there, and we're going to say, okay, who's got the lowest reimbursement rate for this procedure code? Bam, that's now the new norm. And the hospitals start getting squeezed more. It's going to be about what can we do to automate what kind of technology can we apply to it and reduce the cost to drive income? That's, I think, where telemedicine is really pushing us.
Good question. Any other questions from the audience? Okay, I'd like to invite you to adjourn back over to the South Florida Hospital Healthcare Center business over there and visit the exhibits and enjoy the rest of your afternoon. Thank you very much. I'd like to also thank the panel. And we'll be up here if you have a few questions for a little bit. Thank you.